Sustainable healthcare is one of the major problems we have here in the Philippines. In fact, this has been a problem ever since. Not everybody has the luxury to afford to maintain their health. That is why people opt to go to government hospitals because they offer only minimal payments and even free services. Back in 2014, where President Benigno Aquino III was still president, ABS-CBN News mentioned that the Philippine College of Physicians declared a workforce crisis. Only 3,000 out of 66,000 doctors and 5,000 out of 500,000 nurses are working in a government institution, and that then they asked President Aquino to address this issue immediately. In an article by Manila Bulletin, DOH also mentioned that they are lacking 42,000 beds. These are the basic health services that people should have access. How can the people receive a sustainable health regimen if the country is not providing its basic needs? Adding the lack of workforce, then this could prove catastrophic to the healthcare system of the Philippines. Back in 2014, I was hospitalized at the medical center in Manila due to appendicitis. I had undergone a major surgery to remove my appendix because the doctor said that it was life-threatening. The doctors and nurses were very attentive and would provide me the utmost care I needed. I was admitted in a pediatric ward with four other patients inside, but it felt like I was in a private room because of the large space inside. Unlike in June 2017, it was really a different experience. I was playing basketball and due to unfortunate circumstances, I fractured my left hand and was immediately rushed to the Philippine Orthopedic Center. It was more of an expectation versus reality for me. At first, that at first I thought that it would be a great idea to bring me there because they specialize in orthopedics and that I would be given proper medical attention, and I have not been there before. But it was a different story when I first saw that entrance. I saw blood stains on the floor and people who have shattered bones. Due to the overcrowding, people were lying down on the entrance of the hospital and not everybody has their own beds. I arrived there at 9:30 p.m. and got tended at around 6 a.m. I already fell asleep in one of the benches there. They even told me that my case was not even an emergency. I was supposed to be tended at around 3 a.m., but their x-ray machine was malfunctioning, so I have to wait another 3 hours before I could get tended. I was tended at around 6 in the morning before I could get my hands casted. Based on my experience, there is really a huge difference when it comes to private and government hospitals. Lack of workforce, equipment, outdated malfunctioning machines, you name it. Everything is lacking in a government hospital. Filipinos are settling for a low quality care because in reality, not everybody could afford to go to a private hospital. Filipinos have to wait for long hours before they could get tended. Not only have the patients suffered, but also the medical professionals working in the government hospitals. They are outnumbered. They are outnumbered by the patients, and yet they receive salary that is not justifiable. The compensation is not enough. That is why medical professionals choose to work abroad because they are paid the right amount that is proper with their workload. Both are suffering, and this is one of the reasons why workforce is not suffice. But with all being said, I do believe that this could be changed to proper prioritization of the government and its funds. I, as a nursing student, would like to raise this issue because my fellow Filipino people deserve equal quality healthcare. I think the government should prioritize first what is needed. For example, according to the Philippine Star, a new Senate building is being constructed with a budget of 8.5 billion pesos. I do not think this is necessary. The Senate can function properly with their same old building, but I don't think a government hospital can function properly with the lack of equipment, workforce, and facilities. The government should further increase the budget for the healthcare system. This includes further increase of the salary of health workers, new machines, and modernization of hospitals because government hospitals are really outdated. I would also like to emphasize medical education. Medical education is really expensive and not everyone could afford it. There are a lot of aspiring doctors and nurses out there who cannot afford it. The government should at least provide subsidies to aspiring medical professionals. Again, I do believe that prioritization is the key. Funds should be properly allocated and should they assess what is really needed. We can achieve our visions not just only in healthcare, but in every aspects that would make our society better. Una-una lang, know what to prioritize so that we could achieve a sustainable healthcare system that we could take pride and show around the world that we are capable of improving the quality of the lives of our people. Thank you.